This segment is sponsored by Kearney County Health Services.
Welcome back, everybody. This morning, I am joined by Dr. Matthew Rutman. He is a urologist here at Kearney County Health Services. Good morning.
Good morning.
Good to meet you, and we're here to introduce you to a lot of our viewers. Relatively new to the area. How long have you been here?
Yes, this is my 6th month coming here, and it's really been an absolute pleasure to meet a lot of people in the community and to be able to provide urology services here. It's been really amazing.
Well, and what is amazing is your journey to get here. You've been pretty much all over the country, even in my home state of Michigan, Beaumont Hospital. Wonderful people there. I have friends that work there. But it brought you here to Central Nebraska. Wow.
Yeah. So it's interesting. I was in practice in New York City for 20 years before coming here. It was very subspecialized. I saw lots of patients who came to see me for third or fourth opinion. And although it was an honor to take care of those patients, I wanted to kind of get back to the grassroots of why I wanted to urology in the first place, which was a bit to be able to offer services to people that couldn't get to a urologist, people who were waiting a long time, people who were delaying care or maybe not even asking the right questions. So this was really a unique opportunity to allow me and my family to move out to mountain and plains area and be able to take care of communities that really need urology services.
And the patients around this area are blessed to have Dr. Rutman here because you do an array of things for people. So let's start with urology in general. What's that care and the specific care of that?
Yeah, urology's one of those specialties that when you first hear about it, you're like, I would never want to go see that person. When I was in medical school and in training and I would talk to friends or colleagues, they would say, like, why would you choose that? And the long story short is that you get to take care of men and women, young and old, or young to old, that have a variety of issues. So we treat patients with urinary issues. We treat patients with kidney stones. We treat patients who may be having infertility issues, but we also take care of patients who have urologic cancers, things like prostate cancer and bladder cancer, kidney cancer. And at the same time, we get to make a huge difference in quality of life issues, as well as address things that could be life-threatening, although that's not very common. Part of what I loved about urology is there are a lot of surgeries where you have an operation or you have a procedure, you see a surgeon, and you're basically done with them.
Right.
But as urologists, we're a little bit like primary care doctors in a way, whether we're following patients for bladder problems or following patients for prostate cancer screening. So we have the ability to almost act like a primary care doctor at the same time as being somebody who does procedures and surgeries. So that was what attracted to me to the specialty in the first place.
And I think it's important to emphasize for viewers in the area that come to the hospital here in Minden, you touch the tip of the iceberg. There's so many things you can help people with. It's not just one specific thing. And that's important for people to know.
Yeah. I mean, I think if there's anything that's bothering you with anything that I mentioned, if you're having urinary issues, if you're having trouble peeing, if you're waking up at nighttime too often, if you're, for whatever reason, seeing blood in the urine, if there's a family history of a urologic concern, yes, we're right down the street. We're happy to see patients. I'm here at least 2 times per month, so there should never be a longer wait than a couple weeks. And I think it's important to realize that if you have a urology concern, that we're here, we're available, but also not to just assume it's normal. You know, I see a lot of patients who come to see me and they say, oh, I have leakage, but my mom did, or my grandmother did, or my sister did. I just assume that was part of aging. And if something's bothering you, we're here and come let us know.
And you said too earlier that, people used to never come and see doctors like you, or they didn't have doctors available. And it's important to know, don't put those things off, or like you just said, assume it's hereditary or I'm going to be okay, because they never do. And you're here to help with that.
Right. Yeah. I mean, look, the worst thing that happens is you come to see us and we say, hey, you're actually doing pretty well. And, we see you periodically. But I think that the other thing to realize is that even though I'm a surgeon in terms of my training, a lot of what we do is non-surgical. So we do things such as behavioral changes. We do things in terms of medications. And sometimes there are things that might be wrong to where you would consider doing a procedure or a small surgery. But for a lot of the things that we deal with and care with, surgery is not a necessity. So you don't have to feel like you have to decide if you want surgery before even making an appointment to see us.
That's, I'm sure, reassuring for people to hear, because some people, you say surgery and they get so scared. But you just said behavioral changes. What are behavioral changes that could help patients?
Yeah, so it would depend, obviously, on why they were coming to see us in the first place. But for instance, kidney stones. Kidney stones can be potentially prevented by increasing fluid intake. So one of the big things we'll recommend is to drink 2 liters of water per day. For people with urinary issues, with frequency or urgency of urination or leakage of urine, caffeine can be a big culprit. So we'll talk about caffeine reduction. There's also programs where we retrain the bladder, where we're able to keep track basically and get an assessment of what the bladder capacity is, and slowly over time increase the bladder capacity to help with increased frequency, increased urgency. Exercise programs, Kegel exercises, people have heard of those things in the past, but we're able to work with you to try and figure out ways to strengthen the pelvic floor to alleviate urinary tract issues.
So there's a lot of issues, a lot of things that Dr. Rutman can help you with. We need people to make sure that they know that you are available here at Kearney County Health Services, that you're here for. They don't have to travel far. They can just come here to the hospital in Minden. What a great person to have on staff. I'm sure people have already contacted and will be contacting you. So thank you for what you do. Thank you for your concern. For people just need to talk about it. It's okay to talk about it, right?
Yeah, don't suffer in silence.
There you go. Good advice. So thank you for joining us so we can share this with our viewers this morning.
Thank you very much. Very much appreciate it.
Yes, we appreciate it as well. And we'll be back with more Good Life in just a moment. Stay right where you are.